I've been doing robotic surgery now for 8 years. I'll do most cancer operations, be it prostate cancer, bladder cancer, kidney cancer. Most of these are handled robotically, to vaginal vault prolapse in women, the reconstructed. And then there's a whole area of reconstructive urology that can be done robotically also. In fact, in regards to prostate cancer, what we've seen is that 80%, if not more like 90% of all cases for prostate cancer will be done robotically now. Three main things we need to try to improve is cancer control, urinary control, and potency or erectile dysfunction. Those are the three main concerns when you manage patients with prostate cancer. You want to have optimal outcomes in all three areas. And with robotics, we're able to achieve that at a much higher level than what we saw as an open. I believe, number one, our oncology, our cancer control is much better. I'm starting to see less positive margins because our visualization is so much better. Number two, in our urinary control, we're seeing our urinary control come back much quicker than we did as an open surgeries. And then finally, the nerve preservation for potency is much better done robotically than what it is as an open procedure. The reason for most of those outcomes and improvement in outcomes revolve around the magnification. They were able to see tenfold increased magnification, so you can see your structures much more effectively. Doing it laparoscopically, we have a CO2 pressure within the abdomen that compresses some of the bleeding, so the field is not bleeding as actively, so your visualization is much better from that standpoint. Also, our robotic instrumentation allows us to have 7 degrees of freedom. We're actually able to have wristed motions on the inside. It allows for better dissection and reconstruction for patients. So you see that shift within prostate cancer, and we're seeing that shift also happen in things like bladder cancer, kidney cancer, female reconstructive cases. It's also branched into the gynecologic field, much more involved there, also within general surgery. So you've seen robotics expand into other specialties and other interests of urology itself. Also, the technology has greatly improved too. I think we are now through 4 generations of robots, and the robot has become much easier to use. It's ergonomically much easier to use and operate during the case.